Hi, everyone. Welcome to today's webinar, How to Run Automated Telehealth Primary Care Services. I am glad everyone's been able to join. Today with me, I have Jessica Nair. Jessica is VP of Strategy. How are you doing today, Jessica?
Good. How about you?
I'm doing great. And my name is Vladimir Negron. I'm the Senior Product Manager Marketing Manager over at Mend. We have several things to cover today. So let's start off with today's agenda. But before we go over there, I'd like to quickly address a common thing that comes up during these webinars. The webinar deck and the recording will be sent to everyone who's registered. So no worries on those two things. Feel free to ask us questions that we can answer at the end of the today's session during the Q&A. So let's move on to today's agenda. We will cover a few things, starting off with why telehealth and why now, who needs healthcare automation, how automation helps patients and providers, how to prepare for healthcare automation, and we'll finish it off with that Q&A time slot. Again, we'd like you to answer as many questions. It doesn't have to be at the end. So for the questions, feel free to use Zoom's fancy question box at the bottom, and we'll get those answered at the end of the webinar. So let's start talking about why telehealth and why now. I'm sure a lot of you, it should come as no surprise that telehealth has exploded since the beginning of the pandemic. But something to be cognizant of is that the growth that we're expected to see isn't going to just end at the end of the pandemic. According to a forecast from Frost and Sullivan, we're expecting to continue to have growth up to 7 times growth by the year 2025, which is about an annual growth rate of 38%. And the people that are most likely to leverage telehealth the most will coincide in a few different areas, those being deployment of big data analytics. So those are going to help researchers learn more about the way diseases progress among diverse patient populations. Also, user-friendly sensors and remote diagnostic equipment that can lead to successful patient outcomes following telehealth visits or in-person visits, and also adherence to cybersecurity and privacy regulations. These are things that we know are important. They'll continue to be important, especially as the digital age continues to grow. And then practical applications of AI and automation, of which we're going to be talking about a lot of automation during this webinar. Let's move on to who needs healthcare automation. Of course, healthcare automation can be applied to all different types of healthcare specialties, but one of the things that we're seeing, according to an analysis from the director of the Medical Futurist Institute, there are some key specialties that have an ability to leverage these automations with greater focus than some of the other specialties. And it should come as no surprise that general practice, pediatrics, and other primary care specialties are considered among the top specialties, with this being a big future potential when using technology. So we're in the right place. Yeah, go ahead.
Sorry, can I jump in for a second?
Yeah, what do you see here, Jess?
Yeah, something I always love to see, or love to tell providers, I should say, is a lot of times you'll still get some providers that are on the fence in terms of telehealth, where they're so used to doing things in person, they don't know how telehealth could be implemented within their specialty. And really the truth of the matter becomes for providers, for anything that doesn't require physical touch with a patient or a physical exam, you can utilize telehealth. So that's really why you see a lot of these specialties here, because you're talking different conversations that happen with patients, more so than physical touch or physical tests that happen, or checkups or follow-up appointments. That can all be utilized, or you can utilize telehealth for those services. So a lot of practices are figuring out new ways of operating where they can do a majority of services through telehealth and free up their in-person time for those more complex cases.
Yeah, that makes a lot of sense. I know I've utilized it myself as a patient. I'm sure you have as well, Jess, and maybe we'll talk. Let's talk about a little bit more about that, right? How automation helps patients and providers. Why don't you paint us the picture, Jess? As a patient, how do you see automation? How do you see telehealth helping patients?
Yeah, well, I'll actually paint two different pictures for you.
Okay.
One for myself and then one for my daughter. So I have I'll start with my daughter first. I have a 3-year-old. I'm clearly a working mom. I have a very busy schedule, and it's hard for me to figure out times where I can go to my family practitioner, which in this case, I'll kind of lump into internal medicine because that's typically where it's considered. So telehealth helps significantly because I no longer have to go to the doctor's office when my daughter isn't even sick. Maybe she just has a rash and I don't want her around other sick kids. I just want someone to kind of calm my nerves and take a quick look at what's going on to decide what needs to happen. So telehealth is an amazing option for busy moms like myself. If there are any moms or parents on the call, you have to go to the pediatrician, 15 times a month. It seems.
At least.
Lad's laughing. I was telling him yesterday, my daughter, believe it or not, was bitten at school. So that's another trip to the pediatrician that, telehealth was huge for. I didn't have to go in person. So that's one case. The other case is for me specifically. I'm located in Los Angeles. Some of my doctors are at Cedars-Sinai, which is in Beverly Hills, and I'm in the Valley. And if you know anything about LA traffic, it is a nightmare. So ordinarily, when I have a doctor's appointment, I have to miss work. I have to sit in the car for hour and a half, even though this is 5 miles away from my house, which is crazy. That's how long it takes me. Then I have to pay for parking. Then I have to go to the waiting room. I have to wait for, sometimes an hour till I see my physician, all for a 5-minute appointment, depending on what it is, where the doctor generally says, okay, you're fine. And then I have to do the same thing to go home. So telehealth makes my life so much easier because I can, cut down what would have been 5-6 hours of my time into 30 minutes, or it depends on the visit itself, which is incredible. The one downside and the one thing to be aware of from the patient's perspective is I consider myself, technically savvy, when it comes to most programs. But even for me, I get confused with some of the systems that are out there. They require downloads. I wasn't given a link. I don't know where to go. I end up sweating before my appointment. It's a really frustrating, horrible process. And then if I get to the waiting room, if it takes too long for the doctor to be there, I'm staring at a blank screen. So all of a sudden minutes feel like hours for me. And if the doctor doesn't show up, I don't think I'm in the right place. And there have been times, especially for urgent care, where I'll just leave because I don't think the doctor's coming. So, it really opens up a whole new opportunity to make that experience better because there's already so much potential for telehealth to be leveraged.
Yeah, experience would be the key key takeaway that I'm hearing from what you're saying, Jess. And
Absolutely.
telehealth and automation, you ran through the gamut here, really. So I'll just quickly scan over, but we're talking about a variety of things that telehealth and automation can assist in terms of patients. So access, things like automated appointment reminders, one-click entry for patient visits. You talked about an interactive patient waiting room, which is an exciting thing that increases patient satisfaction, and then better care, right? With things like immediate tech support, increased patient satisfaction. And you had come in at it as a parent. Something to note is, depending on the age bracket of your patients, the digital experience that they're encountering is a huge portion of how they're going to see you as a provider and see your organization, and whether they continue to go to you for care. A recent survey from Servata found that 1 in 5 patients have given a negative review of a provider because of a poor digital experience. And then if your patients skew younger, an age bracket such as 18 to 24, it was shown that they were 3 times as likely to consider switching providers over a poor digital experience. So just, I don't know if when you're evaluating providers, if digital experience is first and foremost, but it continues to see as one of the key components that people are choosing their providers from.
100%, especially with something like primary care. There are some, I have to go to a neurologist. So that's a very specific thing where I kind of am locked into this doctor, right? But for other specialties, I have my pick of who I'm going to go to as a patient. And for me, if something is not easy and it's not available at my fingertips, just like an Amazon purchase, unfortunately, that's how I'm also looking at healthcare. And that's how a lot of patients are looking at healthcare. So you need to make sure you're making it easy and enjoyable and a memorable experience, because you almost have to treat patients as customers, which is good in some ways and bad in others. So it's really meeting the patients where they currently are.
But we don't just want to talk about patients.
True.
Jess, let's talk about providers too. So from your perspective, how are you seeing providers utilize automation from a logistics perspective, or other types of things that you feel would really benefit providers?
Absolutely. So, I've shadowed hundreds and hundreds of practices over the years to understand how their back office works. And the biggest thing, and I think what a lot of people overlook, is that there are multiple different, people involved in the process for any patient. So not just the provider delivering care. There's the back office. There's, who's calling, how much time does it take to call that patient, to leave them a reminder, to talk to that patient, to collect payment, to collect the forms. How are the forms getting out to patients? All of that takes time. And as we all know, from the provider or the healthcare perspective, time is money, right? So how do we make everyone's job and everyone's life easier, not replace them, make it easier at the end of the day? So you can utilize automation in such a way where the little minutia is taken care of for each individual person within your workflow, not the huge portions of, delivering care or anything else that still requires a human touch. But the little things, you no longer have to spend hours on the phone calling every patient for the day after, who has an appointment, to give them directions on how to download telehealth, right? Everything can be automated along the process for you. So I think it's really important from the provider's perspective to be looking at what are those touch points that you have on the back end? What can be automated and what do I still have to do? And then the other important thing I'd like to touch on too is we're seeing this more and more with telehealth. You hit on this earlier, it's no surprise telehealth is here to stay. We are at the point we all realize it's important. What's important now is creating a system within your workflow on the back end where you're able to integrate your virtual care and your in-person care seamlessly. And a lot of that happens through automation. Why I say it's such an issue is if the two are considered separate, which a lot of systems are today, that's even more work for you as a practice. And that's, not what telehealth is supposed to be doing for you. It's supposed to be making your life easier and making care delivery easier too. So that needs to be considered as well.
Yeah, totally agree. The fusion of in-person and virtual is going to be first and foremost. We know that as much as things are leaning towards virtual, there will always be a need for in-person visits. Yep. And so having your tools and your automation workflows seamlessly work between those two areas is wholeheartedly, like, it's going to be a key component in terms of success. Some other things that we have on the list, and depending on the size of your organization, may be a bit of a higher aspiration, but we're heading towards that as things evolve. A lot of technologies will move down and be available to smaller and smaller organizations, but early disease detection, so better immediate an ability to leverage algorithms essentially to optimize and review different analysis to understand what might be the health condition of the patient. So an example of this would be UC San Diego Health was recently able to apply algorithms to more than 2,000 unique lung X-rays images, which allowed their clinical staff to quickly identify early signs of pneumonia in COVID-19 patients. Also, on this list, remote patient monitoring, so having the ability to screen the diagnostic needs of the patient, which can lead to efficiencies such as real-time notifications of a patient's current health status. Again, making things easier for the provider, whether it means intervening in real time or possibly even setting up auto-generated medical prescriptions, everything going down to, can we break down barriers, make things easier for the provider to care for their patient, make things easier for the data to be flowing in a way that both the provider and the patient can understand each other and their needs. We're going to move on to how to best prepare for healthcare automation. Jess, how do you see the steps that are useful, the steps that may be even required as you're trying to organize your healthcare staff to apply healthcare automation across the whole organization?
Yeah, I think the first step that's oftentimes overlooked, but it's the smartest thing for a practice to do, is to sit down and almost interview your different staff members and figure out what are the different pieces they need in order to perform their job. Really compile an end-to-end list of what's required, in addition to an end-to-end list of what are the different touch points that have to happen for a patient. As soon as you put that all together, you can very easily identify, okay, what can be automated and what's still manual. right? So I think that's the first step, is kind of organizing it and separating it into buckets for yourself, because then you can figure out what you need and what works for you and how you integrate the manual side of your practice and the automated, so everything is seamless.
Yeah, I would concur with that. And then to add to that, some other things that providers can be looking for and healthcare organizations can be looking for is the ability to accelerate your digital front door utilization. So how are you able to fully integrate and ensure that you can maximize those opportunities for automation across the, not just the virtual visits, but as Jess was mentioning earlier, the in-person visits across your organization, create a digital front door, utilize the technologies that are available to you so that you can truly accelerate that. In addition to that, considering unique use cases for these type of expansions. So as you're just was talking about, as you're going through and discussing this with your staff, can you, as an organization, try to figure out some unique use cases that and options that are available to expand your healthcare automation to more than just like visit substitutions? Of course, we want to grow the opportunities available in terms of virtual visits, but there are so many other facets and ways that you can do that. And then lastly, setting yourself up for success often means being able to quantify the value of automation. So can you be able to, before you get to that point, set the right standards so that you can quantify things like clinical outcomes, access improvement, patient or provider satisfaction? These are all things that you can start utilizing as key performance indicators to understand whether the automation is working for you, or perhaps there are some needs for improvement in certain areas, and you can double down where it works and perhaps seek alternatives in other areas. Jess, anything else before we move on from preparation? Like, are there other key things that you're seeing from your end?
No, I think the only other thing is not only to consider, all the different touch points and what needs to happen from your practice, but also what happens when something goes wrong, right? When something doesn't work for a patient or a provider, which, sometimes it's not even technology, it's human error a lot of times actually. But is that going to be an extra step for your practice where the patient calls your practice and your practice has to figure it out? How will you manage that process? I think that's also oftentimes overlooked. But if you have some sort of support or someone you can rely on for that, or a service, that is ideal.
For those kind of situations, do you typically see committees being created around those ideas, or is it more of just like an ad hoc trying to evaluate what's working, what's not?
So in terms of, if you implement something as a practice internally for there to be a committee that then figures out what's working, what's not, and has a general vision of how this is going to work in practice, that's ideal. I think what I'm referring to is more the day-to-day support system, right? Who's going to support patients? Who's going to support your providers? Who's going to support staff members? Because there's ultimately going to be questions that come up. And truthfully, fielding all those questions can be an additional job in and of itself. So figuring out a service that has that automated and within its structure already, maybe not so much automated, but it's a core functionality of it. That's really important as well.
Let's talk about that, right? A lot of platforms just claim to be a complete digital front door, but few of them actually deliver.
Yeah.
So you're right. So how are you seeing Mend differentiate between its competitors and really push the needle as it relates to a digital first mentality, an automated first mentality, and make things easier for the organizations, make things easier for the provider?
Yeah, I think what's really important. So previously at other companies, I've had to implement telehealth really quickly within different platforms, especially when we were hit with the pandemic. We needed telehealth for our providers as well, right? Separate from Mend. I think what really stood out about Mend is a couple different things. In terms of offering telehealth, mostly every product or platform that's out there, and typically you see this with the cheaper options as well, I will say, it's really a standalone service. So they're only thinking about how do I enable the face-to-face interaction between the patient and the provider, but they're losing sight of everything else that needs to happen in order to get to that patient-provider interaction, right? How do forms get there? Get to the patient? How does the patient get a link to the visit? How do they get appointment reminders? How do they schedule? How do they pay for it? It goes on and on and on. And really, that's where there's this intersection. That's where Mend comes in, where primarily we were built with the practices in mind, right? We figured out what are those workflows for the practice, how do we automate them, and then how do we automate what the patient needs as well. So it gives you everything you really need to make this stand out in your practice. I'll call out, I could talk forever because I'm really passionate on this subject, but I'll call out a couple things that I think are just so incredible, specifically on telehealth. And Vlad, I'll let you kind of take over for everything else. But for telehealth alone, that's often something that just gets, it's a term that gets thrown out there. Again, it's that face-to-face interaction, and that's it. That's typically what you get on most platforms. The difference here is we are thinking of every end user. So first, from the patient's perspective, let's just talk about when they get in their virtual visit, whatever it is. They're typically still waiting. There's an average wait time of 21 minutes for their appointment. And typically patients are staring at a blank screen for that. So one of the biggest differences with Mend is we have what's called the enhanced virtual waiting room, where patients are basically served a Netflix-like library of engaging content that they can choose as they wait, and they are assured that they're in the right place. Their provider will be with them soon. So no longer does that 21 minutes feel like 21 hours. They're entertained, which increases patient satisfaction tremendously. We actually see a 23% increase with those using the enhanced virtual waiting room versus those that aren't. Additionally, with telehealth, let's say, the patient gets into the visit itself. Again, most other services are just a telehealth platform. Maybe it's HIPAA compliant. That's the biggest thing. The difference with our solution, what else is out there, is we offer things like triaging, right? So if you have a nurse that needs to see the patient before a provider or some other staff member, we can automate that entire process. So it really mimics what your in-person care is. We have translators available to you in most languages. We have picture on picture if you want your EMR open. So it really makes things easier from the practice perspective, and also making the patient's life easier in that journey too, with things like a one-click link into the visit. So no one has to remember to download. And, quick side note, I am on a new computer and didn't realize I didn't download Zoom before this, which is why my camera's not on. So that was a whole headache, but that's what patients get. So this is a huge improvement in their experience. Vlad, I'll let you take it away so I don't talk forever.
No, it's okay. I really, what as it boils down, as you're going through it, it seamlessly flows into the other areas that Mend is really championing, and those being things like digital intake forms, messaging, appointment reminders and notifications, payment capture, and patient scheduling. All of those, as you stated already, Jess, are seamlessly built out so that automation works where it will create efficiencies for the organization and increase patient satisfaction. Ultimately, I know, Jess, that's what we're focused on. I know that's what you're focused on, and that's what Mend wants everyone else to be focused on as well.
Absolutely.
We'll move over to the question and answer portion. So again, if you haven't had the opportunity to ask your questions, at the bottom of the Zoom client, you'll have a fancy Q&A button or box that you can click on and ask your questions, and we'll go through them. To start out, let's see. Jess, we were just talking about patient registration and appointment scheduling. It can often be a drag for our practice, is what they're saying. Can healthcare automation help with that? And if so, how?
Oh, absolutely. Let's just take first scheduling. That's the first step that needs to happen. A patient needs to book an appointment. From the patient perspective, let's talk about that. And I'll talk about myself too. I typically don't remember to book an appointment till 8:00 at night. That's outside of operating hours typically. So most of the time I end up forgetting to book my appointment, and then my appointment gets pushed out until I actually remember to call, because it requires me to call the office and be on hold and then talk to someone. And maybe it's a 30-minute experience, end to end. It's pretty frustrating. On the back end, in terms of the practice, someone has to pick up the phone while they're also typically dealing with forms, typically dealing with patients at the front desk. They're managing everything else. If you can automate that entire experience, so no longer require someone to pick up the phone, schedule it firsthand, but have it all available for the patient to do it digitally, that's huge, because the patient, like me, can book at 8:00 when they remember, so they get in faster to see you. And then it frees up time on the back end for your staff, who no longer has to sit on the phone to find a time in the schedule that works for that patient. So that's a huge area where automation comes in handy. And then on the appointment reminder side, this is becoming more and more common with EMRs to send an appointment reminder to patients, typically just via email. But it's really important. I think a big difference with our system is we send it not only by email, but by text message, and we have phone call reminders if a cell phone is not available or it's not accepting. That's huge because it meets the patient where they are. It can also be customized based off of what the practice would like to say. So if you want to include directions to the office, let's say it's an in-person visit, not virtual, that can be done. And the last thing is, automation. Our system is smart enough to recognize what type of appointment it is. Is it virtual or in person? And it can send different reminders. So virtual will have a link to the visit versus in person would be directions to the office, right? So it really, really frees up time where, your staff would typically have to waste precious resources picking up the phone saying, we're on the corner of this street and this street, when really they can be filling out insurance paperwork or anything else that makes more of a difference to you.
Totally. Looks like a question came in through the chat. I'll take this one, Jess. They say automation sounds fancy, but is it secure when it comes to patient health information? So Jess, I know you know this, but for anybody listening in, PHI is of utmost importance to Mend. We take it very seriously. We can't speak to other other vendors that might be um, utilizing automation, but Mend specifically takes security very seriously, takes security as it relates to patient health information, or PHI, very seriously as well. And just this one seems like it would be a good one for you. They're saying that the virtual waiting room sounded pretty awesome. Could you talk a little bit more about how it works?
Yeah, absolutely. This is an area I am really, really, really passionate about. So you will have to stop me for sure from going on about it. But it's similar to YouTube. If you experience, that user experience, that's what we created this off of. So as soon as a patient clicks the link, they're taken through a connection check. So that's also really important. That's a big differentiator, is we make sure their internet's set up properly, their camera, their microphone. So everything is going to work according to plan once the provider is ready for the patient. The biggest difference is right when the patient enters the visit, if the doctor is not on yet, then the patient will be dropped right away into this enhanced virtual waiting room. So that YouTube, Netflix-like experience pops up for the patient. That's also curated based off of the specialty that the patient's going to see. So for example, a psychiatry patient won't be seeing the same thing as a cardiology patient, which is fantastic. It really feels applicable to them. It's hard without an image in front of me, but a couple of big things to point out is it always has a message underneath where the patient's picture is showing their camera that says, your doctor is on their way. Please hang tight, essentially, until they're available for you, which really frees up time on the back end. Because we know virtual care is great. And a lot of patients have the idea that it should be right away because it's virtual. That's not the case. It's just mimicking care in a virtual setting. So you still have to run between different events. Patients run over in terms of care delivery. It really frees up your time because this now gives them something engaging and entertaining. Another thing to point out is this clearly says this is not a direct recommendation or referral from your provider. It's purely entertaining content for you, which the patients really, really appreciate because they're able to just be entertained or educated while they wait without feeling like their doctor actually is prescribing something, right? It's more like mimicking the idea of going to an in-person waiting room if there's a TV on in the corner. It's the same exact experience. Other things to point out, there's also live customer support available in this waiting room for both the patient and the provider. So if the patient has any question, they can just click on that and that goes to our support team. So again, it frees up time and resources from your back end of people that are actually available to you. And then last but not least, a key portion of this is you can, as the practice, can submit your own content, right? So if you have videos of your organization or your practice, you can feature them at any time for your patients specifically. We just have a pre-populated library if you don't have that content. So it really, really is an amazing thing. We've been running a survey of, thousands of patients over the last 6 months, half of which receiving the enhanced virtual waiting room and half of which haven't. And we have seen on average, there's actually a 23% increase in patient satisfaction when they get that enhanced virtual waiting room. So it really is critical to the experience. And I actually just saw this morning, I see the support cases coming through from patients, in regards to the care, and it said verbatim, where is my doctor? This is a case where they don't have the enhanced virtual waiting room. Where is my doctor? This is causing a lot of anxiety. I'm just having a blank screen to stare at, which is the exact reason why we created this, right? It pacifies the patient at the end of the day. It makes them know they're in the right place. It gives them something educating and entertaining to focus on, and really, calms their nerves if the doctor is busy. And then I should mention also, the doctor never sees the enhanced virtual waiting room, so they never have to wait, right, to see the patient. As soon as the doctor joins, this goes away and the patient's entered into the visit automatically. So it's really just there for their enjoyment, and that's it.
Sounds like a win-win to me. Win for the
Yeah.
patient, win for the provider, right?
I think so.
We'll have time for one more question. This one, Jess, why don't you also take it? I was told Mend is only for many providers, and I'm just a sole practice. Jess, why don't you talk about MedFree, which is one of our offerings for people that might be just trying to see what the Med platform is all about, sole providers, and talk a little bit more about MedFree.
Yeah, we have some different options. I think why we were told that initially is we have so many advanced features, and we really, we have customer support and a whole implementation team. And sometimes it is more expensive for a solo practitioner than a Zoom, let's say, or a Doxy, because there's a lot more that our product offers than those solutions. And we want to make it appropriate for the different providers that we're offering our solution to. What we've done is we've created what we're calling MedFree, which is a slightly scaled back version of our product. So you get all of the telehealth aspects, the picture-on-picture, the forms, everything else. You get the enhanced virtual waiting room. I believe appointment reminders are a part of it. There's a lot of other features. I'm forgetting exactly what it is, but the idea is this is completely free to use. And what we've found over time is that tends to be exactly what solo practitioners are looking for. If there's something more, I'd still recommend contacting our team. There's some nuances to that, but I'm sure we could figure something out. But MedFree is really a great starting point. The other thing to know about that is you can almost consider it a trial. So without having to commit to this, large price point, especially for a solo practitioner, it's not large in other cases, but for a solo practitioner, it is. MedFree gives you an option to really try the solution, get used to it, figure out what works and what doesn't. And if you need more, you can upgrade to another solution without having to lose everything you already did. So it's kind of the best of both worlds.
Sure is. All right, Jess, and everyone else who's on the webinar, we're going to close for the day. Thank you again for participating and viewing, everyone. And Jess, as always, thank you for joining us. Hopefully next time we can actually see you. But
I put on makeup and everything. That never happened.
The downsides of Zoom, right? So
yeah. Good point.
Thanks again, everyone. We look forward to seeing you at the next webinar. Please reach out at mend.com/contact if you have any questions. Have a great day.
Thank you.